From 13ABC, Conklin and Company, with 13ABC Action News anchor Lee Conklin. First, with what's happening behind the headlines. And Take 3, our panel of political analysts.
Morning, everybody. Welcome into another edition of Conklin and Company. Thanks for joining us this morning. Coming up on the program today, here comes spring. Believe it or not, 14 days away. No matter what the temperature says, it will be spring. We'll take a look back at what has been the record-breaking winter of 2014, our semi-annual visit with Chief Meteorologist Jay Burschback a little bit later. But also today, despite the calls to repeal it, to change it, here comes health care reform. No matter what, the deadline to insure for those who have been uninsured is March 31st. Health reporter from the Toledo Blade, Marlene Harris-Taylor, will join us a little bit later on. But first, what has become a local and national epidemic, heroin abuse throughout Northwest Ohio, into Southeast Michigan, and all across the country. And here to talk about that from Compass, division of the Zepf Center, is James Schultz. And James, thanks for coming in. We do appreciate it very much. I think a lot of emphasis or attention brought to light with the death of Philip Seymour Hoffman, apparent heroin overdose, but this problem manifesting itself for years now, correct?
Yep. Yeah, I think one of the biggest concerns that we've had over the years is heroin, prescription opiates have lost their fear or their stigma, and folks are becoming injured and using the prescription medications and becoming addicted to it, just not realizing the strength and the danger with that medication. And then also heroin use, which is almost 30, 40 years ago, it had such a stigma. Folks stayed away from it, weren't using it as heavily. It's become cheaper, more prevalent, and folks are experimenting with that. They're using it at parties, or they're switching from their prescription medications over to the heroin because it is more available, it is cheaper, not realizing the dangers associated with it as far as overdose, but then also the strength of this addiction.
Yeah, and it has become fatal for an increasing number of people in Northwest Ohio, Lucas County specifically, and our Alexis Means has a little bit more on that right now.
Police are getting several reports of heroin overdoses and deaths. Lucas County recorded 14 deaths in 2010, 31 in 2011, 55 in 2012, and 80 last year. A local toxicologist expects the number of deaths to increase this year. The Toledo Police Department never investigated drug overdoses. The department has new procedures when a heroin overdose comes in. Detectives, the Drug and Vice Task Force, will be called in to investigate.
We'll go out and collect any evidence. We'll survey the scene, follow up with interviews with hopefully the victim and any of the people that were in the residence, and come up with information and present it to the prosecutor. We'll go after the source, and that's the whole idea, to come up with who's bringing these drugs in, if the drugs are tainted.
Police say the victims in many of these cases are young, white, and from the suburbs. Police believe one way to stop the crime is to prosecute.
The people that brought the drugs into the house, maybe even assisted in administering the drugs. And that is all a crime in the state of Ohio.
All right, that's from a criminal aspect,
right.
Is deaths, overdose deaths increase. And it's interesting, Jim, while that piece ran, you said the scenes almost mirror each other.
Yep.
Go and speak to that.
It's not a respecter of the community, their economics, and we've seen some scenes from the coroner's office of overdose deaths, and I think the impact it had on me was, no matter where it was, whether it was Sylvania or Perrysburg or Toledo, the scene was the same. Pill bottles, alcohol bottles, sometimes the heroin, syringes, some other things were there. But the combining of drugs, whether it's prescription drugs, other opiates and alcohol, all those things lead to these deaths. Also, not knowing the strength of the heroin. Somebody may try to stop for a while, and they become less sensitive to the drug, and when they go back to using again, they are taken off guard, and they don't have the tolerance, and they end up going to sleep at night.
Well, that's interesting you say that, because we had heard that Philip Seymour Hoffman had become clean, and this
for many years.
may have been or was a relapse. It's interesting in talking to the coroner's office, mentioning that this problem evolved from the prescription addictions that have gone on for years in this country. Easier to get over-the-counter medications, oxycodone, OxyContin, and those become more expensive. In turn, people turn to heroin?
Yep. Yeah. 3 or 4 years ago, the main person coming into our doors was suffering from prescription drug abuse. They may have become injured and for years had been using the medication and became addicted to it, or they were using others' medication out of the medicine cabinet from grandma, mom, somebody else in the family, and didn't realize the strength of this medication, became addicted to it, and then years later they would come to us. With all the efforts that we've been putting into controlling overprescription, the education, and doctors working on this, the communities working on it, and the state working on it, and the federal government working on controlling overprescription, overprescribing this type of medication, that's become more difficult to get your hands on as far as prescription medication is more expensive, and the heroin has become more prevalent and less expensive. So when somebody's addicted to an opiate, they get what they need to not be sick or to feel the effects of the drug. The withdrawal is terrible, very painful.
And this is where Compass comes in, right?
And that's
so
where we step in.
At what point will someone come to you?
Usually when they're feeling the effects, they can be feeling the consequences, whether it's legal consequences, whether it's the physical consequences, the destruction of the family.
Is it the family
work.
member who will come first and say, what can I do to get my loved one
It's
to
a
see you?
combination of, I think the family being supportive is always, never give up, always be there, always help the person that is struggling. A lot of times the patient themselves is struggling, and the amount of money they're spending, loss of jobs, impact on their health, on their families, they are also seeking the treatment themselves and approaching us, and treatment does work. There are successful interventions. Detoxifying from this is absolutely necessary. Sometimes medically assisted treatment is absolutely necessary for especially opiate addiction.
Inpatient, outpatient, does it vary?
It can vary for this population. Inpatient and long-term residential is very effective. Medication assisted treatment is very effective, and that keeps the patient stabilized, off all the street, off all the other prescription medications, so we can work on recovery, really work on getting the skills in place to get them back into the community, back into a sober living regimen.
How would treatment vary, if at all, from alcoholism and the detox procedure? Yeah.
Not very much. The issue is both of them have severe withdrawal, and length of time, strength of the medication, how long they've been using, same with that drinking. We basically would evaluate the patient, make some decisions on the intervention that's needed for the patient, and then give them the services that they need, and really focusing on giving them the skills to recover from the addiction, stop the use, and work on those skills long term, because relapse is prevalent with addiction of any kind, and we always want to make sure we give them good skills as they go through the process to continue this beyond the intervention with us. Education, I think, is also critical to stop this before it even begins in the community. I know that the local Mental Health and Recovery Service Board is going to be doing some prevention initiatives, really working on that in the community.
Education in terms of what, though? I mean, what would be?
Addiction, recovery is available, treatment is available, what are the resources in the community? A lot of times because folks don't think it's in their community, or they don't realize that it's not a respecter of your position or your status.
Yeah, Alexis Means in her story, 30, 40, 50-year-old white men.
And that's the trend. 4 or 5, 6 years ago, it may have been 40s, 50s, folks that a little bit different as far as the addiction. That's not the trend in our organization. We're seeing folks in their 20s and 30s, and the folks that are passing away are in their 20s and 30s, which is a trend that has changed in the last 3 or 4 years.
Incredibly troubling. And so now we see the governor, the attorney general, state officials in Michigan, Monroe County. I mean, really putting an emphasis on addressing this problem, from prescription painkillers to heroin now. I mean, really attacking that problem.
Yep, and I think you have to, again, one of the things that we're going to do over the next 6-7 months at Zeph and Compass is go out into the communities, go into all the different communities and have some basic education on what is addiction, where are the recovery resources, what's available in the community, both from a treatment perspective, but also there's a lot of recovery, 12-step, self-help in the faith community. There's a lot of different resources for folks. I think if we get that out there and people realize, be careful of the prescription medications, dispose of them when you're done.
Don't mix them.
Don't mix them.
Yeah.
Call the pharmacy, get rid of the medications that you're not using. Folks, keep that stuff in their home. The fatal effects of mixing medications, but also heroin. Having some fear or some concerns around that type of use, or at least some caution in that type of use.
Okay. James Schultz, thanks very much for coming in.
Thank you for having us.
Shedding even more light on a problem that has become more prevalent in our area and across the country. Thanks very much.
Thank you.
If you need a place to turn for help, there's Compass, division of the Zeph Center, Sassy, all under that same umbrella.
Correct.
There are places to turn right here in Northwest Ohio. We are back on Conklin and Company in just a minute. We'll take a look back, although not quite finished yet. We'll take a look back at what has been really a winter to forget here in Northwest Ohio. Back in just a minute.